Hi everybody, it's Chauntae Gold here, also known as the Path to Gold on Instagram. Thank you so much for tuning in and listening as I talk about one of my passions, which is applied behavior analysis within the health and fitness space. It's been a while. I kind of went on a hiatus there for a little bit after the first episode for various reasons. One, I got married a couple weekends ago, so I was kind of busy planning and preparing for that. But also, and more importantly, it was mostly due to the social climate that we've all been experiencing these past couple months in terms of our racism in our Black community. And I kind of just wanted to take a step back and process everything that was going on, and take some time to learn and observe what is going on with our society and within our field. So that is why it took me so long to, do the second episode. But during that time, I was talking to one of my close friends, Trina Mendoza. She also works in the health and fitness space, and she's also a BCBA. So we were talking pretty much every day, just, kind of going back and forth and exchanging what we were observing within our field. And so I decided to invite her on here to talk about some important topics. So hi, Trina.
Hi, how's it going?
Pretty good. Trina is gonna, start off by sharing her background, how she got into the field, her business. You probably know her from Instagram as Data-Driven Performance. So she's going to talk a little bit about that before we dive into our topics today.
All right. So hello, my name is Trina Mendoza, and I run Data-Driven Performance on Instagram and Facebook. So I'll start by talking about how I got into this field. So like a lot of people that fall into this field and fall in love with this field, I started out with no previous awareness or even knowledge of what applied behavior analysis was, or even really individuals with autism. I had no experience working with developmental disabilities or anything like that. So when I was a senior at Sacramento State, I decided that it was about time that I found something that was relating to my college education. I had just worked a bunch of retail jobs, and Dr. Jane Howard had come into one of my psychology classes and was saying that they were interviewing for behavior technicians at the time. So I decided to go interview there, and they explained that I would be in the home one-on-one by myself, working with a child with autism and teaching them skills and working on their problem behavior. And honestly, it really kind of scared me, and I ended up not working there just because I had no experience with children. I had no experience with children on the autism spectrum or developmental disabilities, and I didn't want to be alone in somebody's house working with a child.
Yeah.
So I ended up not doing that. And a couple months later, I was working at a large corporate gym in Sacramento, and one of my coworkers was telling me how her sister was a behavior analyst at that same company that I had previously interviewed at. And she was running like a school program, like a small school setting. And I ended up going to interview with her again. And I liked that there were, always like staff and behavior analysts on site, and somebody could help me if I needed help or had a question. And so that's when I ended up working there. And I've been here ever since. Learning about ABA and like how to do DTT and how to praise behaviors that you wanted to see increase and how to provide reinforcement. I was still working at the gym also, and I just found a lot of things that were similar with the two, like changing health behavior and changing behavior of an individual, diagnosed with autism. So I really saw like a lot of overlap there, and I've always had a lot of interest in applying ABA to health and fitness, even though I've always worked with individuals with autism. So Data-Driven Performance started out just as like a passion project of mine to post about how ABA can be applied to like weightlifting, nutrition, health and fitness. So yeah, that's how I got started, and I provide one-on-one coaches to athletes with just general health and fitness goals, individuals that compete in weight class sports, so like weight class management and just like overall health and fitness goal setting and planning.
Mm-hmm. Very cool. Awesome. Thank you for sharing. So just to give you guys a little background, guys, Trina and I know each other. We know each other. I invited her on here. um, but we met each other on Instagram. We have a mutual friend who is a power lifter, and Trina found me on Instagram. And at that time, I was experimenting with Olympic weightlifting, and Trina is an Olympic weightlifter, and so she reached out, and we've been friends ever since. So
Yeah.
yeah, it's been what, like 3 years now, 3, 4 years,
Yeah,
something
3 or 4
like that.
years now.
Yeah, really cool. So obviously, we talk every day about all the things, behavior and health and fitness, and just everything that we obviously have a lot of things in common. So that is how we became friends. So now we're gonna dive into our topics. We're gonna talk about a variety of different things, but they're all related, I promise. I want to start the conversation by talking about racism and how racism exists in subtle ways within our field and within the systems that we occupy. I'm also going to highlight some organizations within our field who've done an excellent job at addressing these issues and have committed to tackle racism within our field. And then we're going to dive into the health and fitness portion, how racism exists within health and wellness space. And then we're going to share some solutions that we've come up with to help kind of dismantle these problems. And we'll go from there. So, what people in 2020 think racism is. So, I'm going to go through this list, and I'm sure you guys, will think this too. And I don't want to say that these things don't exist. These ideas of racism absolutely exist in our country today. So, for example, like racist derogatory language, discrimination, Confederate flags, the KKK, Nazi tattoos, hate crimes that, for example, that we've seen in Charlottesville. And like I said, obviously these things are still happening in our society today, but it's really easy to miss when it's not those behaviors, right? It's really easy to miss when it's not just like in your face, KKK with like the Confederate flags and all that. So I created a list here on, just some subtle ways that racism exists within our field specifically. So underrepresentation is a huge one. People of color are widely underrepresented in our agencies and in leadership teams within our agencies and in various special interest groups. That's what we've been noticing lately. And during the Blackout Tuesday, when that whole week, some other things that I would hear as well would be, people of color would be silenced or not taken seriously when issues about race or injustice are brought up in leadership teams or meetings. Also, our conference speakers. We have to really think about the demographic of our conference speakers, and I really don't see diversity or large representation of people of color when we go to conferences. There's a lot of white speakers, and the rooms are typically filled from wall to wall. So that's something that I personally have noticed, and I'm sure Trina has as well. And then just some other ones at the top of my head are our time and attention as behavior analysts, where that goes when we go to these conferences. Like I just said, conference speakers who have white speakers the rooms are usually filled, and then the very few people of color are speaking, it's usually not like that. So we have to always be mindful of where our time and attention are going to, and making sure that we are filling the seats for, people of color who are speaking as well, because that matters. And then, of course, representation within the health and fitness space. So we're going to get into that a little bit later. But first, I want to talk about some organizations and special interest groups which again, who have made the effort to address racism. These are people that I highly suggest, not people, but these are organizations that I highly suggest following. And if you are in the market for CEUs, or learning about diversity and racism, and how to, be a part of the solutions moving forward, I would highly recommend you guys following these groups if you're not already. So the Latino ABA, so LABA, the Do Better Professional Development Movement, they have excellent information, not just obviously about racism, but about just being a better clinical practitioner, expanding our creativity in, our field. The Behavior Bitches podcast, of course, they have done an excellent job with elevating elevating the voices of people of color, and they've been pretty consistent with that across the board. BABA, of course, Black Applied Behavior Analysis, and the ABA Task Force, they have been coming out with so many different types of CEUs talking about social injustice and racism and solutions, obviously from a behavior analytic lens. And so I've been really enjoying their meetings and their CEU events. It's been really great. And then also there's CalABA. And then, of course, the Beautiful Humans podcast, which they've always been a social justice podcast and hosted by two behavior analysts, obviously. But yeah, so I just wanted to highlight those organizations. They have been doing an excellent job with just tackling these issues and, raising awareness within our community. So, saying that, I don't know if you wanted to add anything to that, Trina, or...
No, I think you listed what I've been following as well. So.
Yeah, I figured. Okay, cool. So now we want to talk about how racism exists within the health and wellness space. Obviously, since Trina and I are BCBAs who specialize in health and wellness, we want to talk about how racism directly impacts people of color in this space. So Trina is going to talk about some general barriers we've noticed during our time in this field.
So the first barrier that may affect people of color being able to engage in health and fitness behaviors are just the general cost of gyms. So a general gym where you do your own thing might run from anywhere from $20 to $60 a month. However, you would have to basically teach yourself how to exercise or pay a personal trainer to teach you if you're not really aware of what you're doing and how to execute exercises with correct form so you don't get hurt. Or you could potentially buy a program online. But this all comes at a cost. And also, you could also go to a more specialized gym like a weightlifting gym or a powerlifting gym or CrossFit. And those often come at a price tag that's usually over $100 a month, which can get costly. You could also work out at home, but if you need equipment, that can also be very expensive. Mm-hmm. So a second barrier is that the location of these gyms typically are not in the inner city. They're in more middle-class cities. So there might not be a gym in an area that's more urban. And so another point we wanted to touch on that could be a barrier to engaging in fitness behaviors. A gym is not necessarily needed to work out. But if you live in a neighborhood where you don't feel safe being outside, where you could go for a run or walk or go work out in a park, that is potentially, a barrier. I know, Chauntae, you've talked about when you lived in Koreatown, just feeling unsafe, like walking from your car to your apartment.
Oh, yeah.
And the same thing goes like when I used to live in Long Beach. At that point, I was training for like a full marathon. I don't even run now, but at that time I was, and I really had to go out of my way to find places that I felt safe to exercise pretty much.
Yeah, that's a huge one. Yeah, like Trina mentioned before, when my husband and I first moved to Los Angeles, we moved to Koreatown because there was some cheap housing over there, and cheap for a reason. I mean, it was a terrible neighborhood. We had to pay like $500 for parking. That was like half a mile away from our apartment, and it was just very unsafe. I got harassed every single day that I walked out of my apartment, and as a woman, that could just feel really uncomfortable. And so I just couldn't imagine staying in an environment like that for so long. I can only imagine that if I had no way to get out of that environment, the last thing on my mind is working out. You know what I mean?
Yeah.
The last thing on my mind is going to be going for a walk because I need to be healthy. What's going to be on my mind is staying inside so I'm not harassed all day. So yeah, that is 100% huge barrier with unsafe neighborhoods and health.
So another barrier is just the overall cost of food and accessibility to healthy food. So a lot of the times, these areas that are more urban or inner city are deemed food deserts, meaning that they don't really have access to fresh produce and more like unprocessed food. Typically, their main place where they can buy food or like a corner store that just has like a bunch of snacks and like processed foods, soda, everything in a package that isn't perishable. So really like that accessibility to healthy food is definitely a barrier in more urban areas, and just the cost of food. So if you live in an urban area and you don't have a car, it's going to cost you some money, taking an Uber to go, somewhere where you can buy fresh produce. And then when you get there, maybe it's a little bit more expensive because it's in a more affluent area. So that's definitely a barrier to, the nutrition aspect of health and fitness.
Yeah, for sure.
So another barrier is just the general like health and fitness marketing. A lot of the times is just health and fitness programs and products are a lot of the time marketed to a middle or upper class, and in general just I think to a more white clientele. And a lot of the time nutrition that's really like labeled as being healthy, like whole foods, or organic, non-GMO, vegan, those really come with a higher price tag.
Right.
So
And
that's definitely a barrier.
Yeah. And they're just, yeah, what Trina was saying earlier, they're just marketed towards white people. And it's funny because if you follow me on Instagram and either of us, we are not vegan. We don't practice veganism. And, for a really long time, I really did think that it was like a white thing. But I'm just being honest. And ever since, the Black Lives Matter movement and everything that's been going on, and I've been, seeing a lot more Black vegans and the history of how they have always there's a community of them that have always been around practicing veganism for a really long time, and a lot of the things that they say is it's not as expensive as what people are marketing it as. It's actually very affordable. And again, this always goes back to lack of representation. And I think that's going to be our theme today because it's so important for people to be a variety of different people from different demographics to be represented within, the health and wellness space, just so people know that, okay, I can do this. You know what I mean? Like I see somebody who looks like me who's adopting these healthy behaviors, and I want, it motivates people to want to be like that too.
And definitely going back to the marketing piece, one thing I was thinking about too is that if it's marketed to a middle or upper class, white individual, maybe other groups that may be interested in eating healthier, eating vegan or eating more organic food, they might not even be exposed to that kind of media.
Mm-hmm.
So they really aren't gaining the same access to just like general information about those products.
Right. Yeah, like I said, this wasn't until Blackout Tuesday where all of these organizations and Black people of color talking about health and veganism, and I didn't even know they were out there just because I haven't come across their pages. And then, I mean, if you guys follow us on Instagram, you know that Trina and I did a sticker donation. We made anti-racism stickers, and the money that we raised for the sticker sales, we found this organization in LA called Supermarket, which was an organization that produces whole nutritious foods and sells it at a low cost for low-income communities here in LA. So yeah, I mean, they're out there. I mean, we just need to make sure that they are in the forefront of, what we are consuming in the media.
Definitely.
Okay, so I guess it's my turn. We are going to go and talk about lack of education and school lunches. I kind of wanted to take a little turn into this. And, when I first started researching, lack of nutrition education within low-income communities, I started to actually find a lot of organizations that actually provide a lot of education, free education for low-income families. And so I wanted to highlight those because I think not a lot of people know about them. So, for example, the program Women, Infants, and Children, they provide nutritious food education, breastfeeding support, and referrals to healthcare and social services for low-income families. And in 2018, almost 7 million women, infants, and children received benefits. And this is funded by the U.S. Senate and House Appropriations Committee. And I saw something on Facebook the other day that said the Black Panther Party started this organization.
I didn't know that.
I didn't know that either, and I'm just seeing what I saw on Facebook, so I did not fact check that. So if you're listening to this and you're curious about it, feel free to, investigate further. But because, what we see on Facebook can get a little iffy. So I'm not saying that this is a fact, but I just saw it and I thought I'd mention it here. I'm definitely going to look into that later. So yeah, I thought that was
I'll be Googling that later.
Yeah, so will I. I didn't have time before this episode, but we all have Google, so feel free to do your research after this. There's also SNAP, so the Supplemental Nutritional Assistance Program, and this is obviously 100% funded by the federal government. This is also known as food stamps. They just labeled it differently. And then there's the National School Lunch Program, and this is a federally assisted meal program operating in public and nonprofit private schools and residential child care institutions. And this program provides nutritionally balanced, low to no cost lunches to children each school day. And this is so important because children deserve whole nutritious foods. I mean, this was something that I was starting to get really I am still concerned about it because we go into schools. We do ABA in school districts here in Los Angeles, both Trina and I, and every single school that I've gone to, the nutrition for the kids who receive lunches there is absolutely horrendous. And so, that is also something to investigate a little bit further on why these specific schools don't have the money to have nutritious foods. Because these programs are available, so I'm not exactly sure why not all schools are able to have the same opportunities. But it's so important for children to have nutritious, balanced meals at school. And then there's this other program that I absolutely loved. It's a nonprofit organization here in LA called CLA. That's SEELA. Sustainable Economic Enterprise of Los Angeles, and they have two programs within this organization, and one of them is called Bring the Farmer to Your School program, which is exactly what the title says. A farmer comes to the school, brings what like vegetables or any other produce that they farm, and they educate the children on how to
grow food and
yes. They educate the
vegetables and stuff like
yes,
that.
Exactly. They educate the children on how to grow food. how it's farmed, how it's sustained, all of those things. And I thought that was really cool because they paired education with the food itself. And then also there's a free nutrition education program for low income families. So they can come to a center and they do nutrition classes. And not only do they do the educational portion, but they teach them how to cook. And so I thought that was a great program. And again, this is free if you just go in there and apply. They have that readily available. And so again, I just wanted to highlight the programs that are out there to help aid the disparity of low income families not being able to access these privileges that a lot of us get to have. So again, these are just some of the programs that I found useful. I, you know, as much as these programs have been helping thousands of families, there are still a huge number of families who are not aware of these programs. As you know, I talked about in my last episode, on the obesity rate here in America is up by 40%. And so clearly, there's a huge, portion of us who are not educated in nutrition and need programs like these. Unfortunately, a large part of that 40% is occupied by Black and brown, people of color. So there is some disconnect there. Perhaps I'm assuming that a lot of them don't know about these programs or what organizations out there that can give them free access to education and learning the basic skills of cooking and grocery shopping and food choices and things like that. Another barrier that we talked about is the less exposure to extracurricular activities due to single parent homes and parents working multiple jobs. And so we know that when kids or youth are left at home for long periods of time without parental supervision, that they're more likely to seek activities that are probably not in their best interest. So obviously, I think a big solution to this is, again, it kind of goes back to representation. These kids need people to look up to. So they need teachers, they need tutors who look like them, they need law enforcement people to look like them. We just need more representation of people of color in multiple occupations, so youth can look up to that and know that there are better things for them out there. But then again, also we just need more like after school educational and activity programs that they can do, which I'm sure they're out there. We just need to do a better job at
having those be available
yes.
for kids in inner cities.
Yes, exactly. We just need to structure it in a way that's easily accessible. So yeah, we are gonna go into. Oh, Trina, did you have anything to add to that?
I guess just that that can be a barrier in itself when your parents are working and you don't really. Sometimes children that live in homes where I've seen this within my own clients over the years. Lower income families where both parents are really busy and working. Sometimes a lot of the other children take on a lot of the responsibility of a parent, so they might not have as much free time,
right,
to even do anything, like go play a sport or go play outside, since they are taking on some of the roles that their parent would do otherwise if they were home.
right. Yeah, that's a really great point. All right, we are going to go into some solutions to help improve, minority groups and low-income communities and families. So Trina's going to start with that.
All right. So one solution that we're talking about, Chauntae and I were discussing, was just increasing education as far as like health and fitness and nutrition, and just doing a better job within the health and fitness space of normalizing basic nutrition, basic health. So a lot of the times when you scroll social media and you look at an account of somebody who has a huge following in the health and fitness space, a lot of the times when they post their meals, like they're super nice looking and they're super fancy, and they're using like all organic, vegetables and just like really complicated, extravagant meals. And really, that's not necessary to meet your health and fitness goals or just to be healthy. Really, you don't need to be eating like all organic, non-GMO, free range, meat, grass-fed beef. Really, I think it would be nice to see more people in the health and fitness space just normalizing very basic skills, like how to, add more vegetables to your diet, how to add more lean protein to your diet, how to make like a more balanced meal. I think those kind of tips really would be more beneficial for a general population.
Yeah, for sure. I 100% agree. Again, because when we're trying to think of long-term solutions, we already know that one of the solutions needs to be within the public health, within public health and restructuring the infrastructure in communities and things like that. So that is going to take a long time before we start to see some improvement. And in the meantime, the only thing that, low income families have access to are the little markets down the street or the gas station down the street. So how are we going to teach them to manage their nutrition with the stuff that they have available? There is a way. There is a way. And it kind of goes back to what Trina was saying, is normalizing things like frozen vegetables and canned vegetables and just simple things like not everything has to have a fancy label on them. It could just be, the things that you have available. So yes, that is for sure a big one.
So another idea for a solution on how to include, people of color in the health and fitness space is just to elevate their voices and give them more representation. So health and fitness is still largely dominated by white individuals and typically white males, but just in general, giving, like, if you are a person that has a large platform within the health and fitness space, sharing and supporting the work of people of color, I think is really important. And giving them a platform to be heard and to be known also.
Yes, huge. That is huge.
So another solution for health and fitness within ABA is just, I think that there needs to be more research done. There isn't much research right now within our field for health and fitness. And typically a lot of the studies, if you look into studies that are looking at increasing fitness behavior, like increasing your steps, typically it's done with college students. But it would be great to see more research done with a general population or underprivileged children, or just a wider range of research participants. I think is definitely needed.
Yes, absolutely. Yeah, a lot of the research that we've read is a lot of this using the same things, like the Fitbits, and it's a small representation of like college students, and very limited with who they're studying. So we just need a lot more representation and creativity in research. Now, I want to talk about how we as behavior analysts can do our part in, within our field to help improve overall health, and how we can drive change within, health and wellness and racism. So some things on the top of my mind are expanding our field outside of autism. This is huge. And some fields that I'm thinking of is public health, politics, health and wellness. These are huge spaces that definitely need our help to address racism, to help fix some of the problems that we've been talking about today. Another thing, volunteering and building rapport with staff to share our knowledge about behavior analysis, holding our agencies and leaders accountable for addressing racism and diversity in the workplace. This is huge, and I'm sure all of us have received those emails from our agencies about everything that's been going on. And so, I think that it's part of our responsibility to hold them accountable to those words and just make sure that they are doing their part as agencies to make sure that they are helping people feel heard within our communities. Donating is a big one. If you are able to, donating to youth outreach and organizations that are already doing the work. So we don't have to go out there and reinvent the wheel. There are already people who are putting their time and effort and work into helping the Black community and people of color. So like Black social workers and mental health counselors, Black educators. Again, I'm going to, go back to representation. It's so important that we have a variety of successful people of color represented in high-paying jobs. We need those models for our youth. And so I think that if we as citizens, want to donate, those are the organizations and those are the people and jobs that we need to donate to, people who are already doing the work in these spaces. And then another one that I thought of was hiring people of color to speak and educate employees and agencies on various topics outside of race and diversity. And I said that specifically because I've noticed that there have been, a lot of Black women and men hired by different people to educate us on race and diversity, but they obviously know things, are very well educated on things outside of this topic. So making sure, again, that they are represented for various topics outside of just race. Do you have anything else to add, Trina?
No, I definitely think that last point is really important because I know after, everything happened and a lot of agencies, like even within our own field, we're really looking to, hire and do some cultural competence training. Mm-hmm. Sometimes personally, I am a little bit turned off when I watch this training and it's like a white woman telling me how to be culturally competent, but at the same time, I think we also, like you said, need to make sure that we're also giving these same people that are going to train us on how to be culturally competent because they live the life as a colored person. Yeah. We all give them an opportunity to educate us on other topics that they are also probably experts at.
Yeah, for sure. Yeah, that's really important, definitely. All right, guys. So I think that is our, everything that we've got today. And I hope that we were able to deliver some useful knowledge and opinions and information on how we can do better as behavior analysts within our fields. Thank you so much, Trina, for coming on here and doing this with me. It was so fun.
Thanks for having me.
Yes, of course. All right, guys. I will see you and talk to you later.